Hi everyone, my name is Kate Martin. This is my pathophysiology presentation. So let's talk about disease. A commonly known disease would be malaria. Disease is the deviation or fluctuation in some way the body works. It can be a change in tissue, a change in an organ, or in a whole body system that causes illness. So malaria would be a commonly known disease. You can classify diseases in multiple different ways. Biggest ways to classify them are you can consider them to be congenital, which means that the disease is present at birth. A common congenital disease would be cystic fibrosis. You can also consider diseases to be acquired, which means that that structure, that organ or system is fully healthy at birth, but at some point along the way in your life, you acquire that disease. So frequently in high polluted areas, a person can just acquire asthma. That would be considered an acquired classification. You can have classifications from the organ, the structure, the function, and you can consider classifications by how they are treated. You can also consider them by their etiology. So any virus would be a classification of disease. Talking about etiology, the etiology is the cause of the disease. So we talked about malaria earlier. The etiology would be you go to an area where malaria is common, out in Africa, and you are bitten by a female mosquito which holds a certain type of parasite that is then transmitted into your bloodstream, and you are infected with malaria. You can also get malaria from like needle exchange with dirty needles or blood-to-blood contact with an infected patient. That's what etiology is. Pathogenesis is the step after etiology. So where etiology, that bug bite or virus or whatever the cause is, that's the etiology is the very first step. The pathogenesis is immediately after all of the steps that progress into an evolution of disease. So when you consider COVID-19, the etiology is the COVID-19 virus, and you would frequently get it get some sort of that particle in your mouth, your nose, your eyes. Our mucous membranes are the really vulnerable spot in the human body. The pathogenesis of COVID-19 would be considered the spike protein on the COVID-19 molecule, which will be usually inhaled droplet through droplet transmission. They go straight to the endothelial cells of your lungs, your nasal tissue, your bronchioles, and they that COVID spike on the viral cell will connect with your host receptors, your cells there, and then the spike will get cleaved off by the COVID cell. There's a certain protease enzyme that the COVID cell came, so it would spike into the host cell, be cleaved off, and that would allow the cell to fuse with your host cell. The viral cell drops its RNA particles and all of its viral material into the host cell, and then uses it as its own little virus-making factory to reproduce baby virus cells, as well as more RNA material to go infect more other cells. The host cell then splits open and releases all of those baby cells and RNA into the bloodstream to further just cause massive effect on primarily your respiratory system. Frequently, healthier adults and children had a very, very strong fast and strong immune reaction to that initial infection, and they were able to release a cytokine storm and pretty much stop that illness. And then you would just kind of see the runny nose, the fever, the headache, the very more mild symptoms, as opposed to the elderly and the immunocompromised patients who would not have as quick or as strong an immune response. and the virus was allowed to continue to replicate and just cause massive damage, especially to the lung bronchioles. You would see progression from common cold symptoms more into ARDS, acute respiratory distress syndrome, and just, you know, the vasculature of the lung bronchioles it was just pure chaos, and the patients, we were really unable to oxygenate as a result of that infection. So that is the pathogenesis of COVID-19. As far as signs and symptoms, a symptom is something that a patient would complain of, such as a headache or stomachache, and a sign is something that the healthcare provider, when examining the patient or you know, taking vitals or something like that, the healthcare provider is able to objectively notice that in a patient. So if a symptom is an abdominal pain, a sign that would go along with that is increased abdominal distension, or maybe an increase in heart rate, increase in blood pressure that you would be able to see if perhaps the patient was in a lot of pain. That's the difference. A syndrome is something that a syndrome can be considered a cluster of signs and symptoms. There are certain clusters that if you meet several different factors in that cluster, maybe not all of the defined signs and symptoms, but some or most of them, then you can consider this person to have a syndrome. And a syndrome is different than a disease in the fact that, you know, it's this cluster. We may not have as solid a grasp on the etiology or the defined, you know, standard of treatment, but at least you're able to put a name on this cluster of this cluster of signs and symptoms, to have somewhat an idea of what illness you're dealing with. So irritable bowel syndrome is the common one. Also, polycystic ovary syndrome is a very common syndrome, and it helps. We're able to treat it. We have treatment options. We have kind of ideas on etiology, but we're not as solid as perhaps someone with cancer. We have a little bit more answers for someone like that. A diagnosis is when the healthcare provider is able to put a name on the illness after examining a patient and taking their history, physical, and their signs and symptoms. So a cancer diagnosis would be a common diagnosis. Complications are sort of adverse events that occur, adverse effects of either having a disease, or you can have a complication from a treatment when trying to treat that disease. So decreased hunger, cachexia, kind of wasting, would be a complication of an initial cancer diagnosis. And then you can even go in and try to remove some of those neoplasm surgically and accidentally nick an organ, the bladder, intestines are common. That would also be considered, it's a surgical complication, but it's a complication of the cancer that we were initially trying to treat. And prognosis is an expected course and outcome that goes hand in hand with a diagnosis. So you can have a diagnosis of a broken bone, and the prognosis is, you know, you'll make a complete recovery after 6 to 8 weeks in your cast. Or a prognosis could be for cancer, saying if you are very aggressive in your chemo and radiation, then you will probably have about 6 months to survive from this point with aggressive treatment. And that kind of helps with treatment options when patients are presented with a choice to make. And finally, I have diagnostic tests. That is it can be a blood test, imaging, a procedure, a biopsy of tissue. It can be either invasive or not. You can take a blood test. Frequently, we will see patients on the ventilator in the ICU. We'll make a ventilator change, change one of the settings, and then about an hour later, we'll take an arterial blood gas, which gives us several different numbers to tell us how well the patient is breathing. That is considered a diagnostic test. We may already have the diagnosis of whatever respiratory issue this patient is facing, but it can diagnose what we're facing, and it can also help us with to know the efficacy of whatever treatment we're providing for that diagnosis. That is all I have. Thank you so much for watching and listening, and I hope you guys have a great day.